Hello, this is Morgan Atchison for NU607. This is my HPI and mental health exam. For this assignment, I will be using a clipboard just for simulation purposes with one blank sheet of paper.
Come in.
Hey, Miss Smith. How are
I'm good. How are
you? Good. My name's Morgan.
you? Nice to meet you.
You prefer to go by Miss Smith?
Yes, please.
All right, I'll be taking care of you today. So, tell me, Miss Smith, what brings you in?
I have been having a really bad headache for about the past week.
Okay. All right. Do you mind if I write some things down while I talk to you? Okay.
That's fine.
So headache the past week.
Mm-hmm.
Where's it located? Is it on top of your head, front of your head, back of your head?
It's the back of my head.
Back of your head. Okay. So how long does it last? When it generally happens, how long does it stay?
About an hour or two.
One to 2 hours. 1 to 2 hours. Okay. And is it like a sharp or a dull pain?
It's a dull pain.
Okay, dull.
Mm-hmm.
All right. And have you tried anything to help alleviate the pain? Have you taken anything?
I tried some Tylenol,
Okay.
but it didn't really seem to help.
Anything make it worse? Your headache.
Noise kind of aggravates it, but not light or anything like that.
Okay. And does it stay in one spot, or does it move, or does it maybe radiate anywhere else? Does it affect anywhere else?
Yeah, sometimes my neck will also start to hurt, and then my shoulders, but it's mostly just right there at the base of my skull.
All right, base of the head, back of the skull, neck, and shoulders.
Mm-hmm.
Okay. And when does it normally occur? Is it like an all-day thing? I mean, does it happen sporadically, morning or night or in afternoon?
It's usually late afternoon.
Okay, it happens in the late afternoon. Okay, and severity. Like if you was going to compare it on a scale of 0 to 10, 10 being the worst pain you ever felt, what would you?
It's about a 7.
A 7. Okay, 7 on the pain scale. So I'm just going to recapture what we've kind of talked about here. You've been having a headache for the past week. It generally starts in the afternoon to the back of your head. It lasts anywhere from 1 to 2 hours. It's a dull pain, but it's a severe pain at a 7. You've taken Tylenol to relieve it with no effect at all. It's noise tends to make it worse, and it can radiate to down your neck and your shoulders. Are we kind of on the same page? Okay.
Yes.
All right. So since it's our first time meeting together, I'm gonna have to do like a history and physical on you as well, and maybe just ask you a few personal questions so we can kind of establish care here. Is that okay?
Yeah.
All right. If at any point in time you feel uncomfortable answering any of the questions, you can always just say, "Hey, I prefer not to answer that." Okay. So let's start with your health history. Any diagnosis you've ever been diagnosed with anything?
No.
No, hypertension, diabetes, anything like that?
No.
Okay. When was your last, have you ever been hospitalized?
I was in the hospital earlier this year in May. I had a baby.
You had a baby. Okay, healthy baby?
Yes.
Little boy, little girl?
Little boy.
Little boy, okay. So, and when was that? You said May?
Mm-hmm.
May, okay. And so, any other hospitalizations?
My daughter in 2016.
Okay, so you have 2 kids. You have a boy and a girl. Okay, well, congratulations.
Thank you.
Things going good at home?
Yes.
Stressful?
Of course.
Of course, very stressful. Okay, so I understand that. Okay, so that's the only 2 hospitalizations you ever had?
Right.
Any surgeries?
No.
Were your 2 kids, were they vaginal births?
Mm-hmm.
Okay, vaginal, nice there. Okay, everything went well there.
Yes.
Okay, good deal. All right. When was your last menstrual cycle?
September of last year.
Okay, so it was before when you got pregnant. Okay, so are you breastfeeding?
Yes.
Okay. And so no, other than having the kids, no significant history. Any allergies?
No.
Or do you think no? Medication, you're taking any medications ever, like herb, over the counter?
I take a multivitamin every day.
Multivitamin every day, okay. Okay, so never been diagnosed with anything. Multivitamin every day, no allergies, you said?
Correct.
You said no allergies, okay. All right, when was the last time you had a physical done or seen a doctor?
I haven't been to the doctor in about 5 years.
5 years,
I've just been way too busy.
Been busy, so it wasn't anything that they did, that healthcare done to make you mad or anything like that?
No.
They didn't say anything upset you? Okay, so you've just been busy. What do you do for a living, if you don't mind me asking?
I'm a nurse.
You're a nurse, okay, so college education, got out. How long you been a nurse?
7 years.
7 years. You married?
Yes.
All right. Everything going good at home?
Mm-hmm.
All right, okay, and stress at work? Have a lot of stress at work, stress at home? Yeah. Okay, so mainly you had to be into a doctor because you just been busy. Okay, all right. I've laid a few things on the table here as we're going through the exam. Just kind of take note of those. I'll ask you some questions later.
Okay.
All right. So you've been on any trips lately? Travel outside the country, anything like that?
No, not outside the country. We did go to the beach earlier this year in March.
Okay, went to the beach in March. Okay. Do you use any tobacco use?
No.
No tobacco use. Okay. Alcohol?
No.
No alcohol use. Okay. You are employed. You're married. Any illicit drug use?
No.
Okay. All right. So with these headaches, family history wise, your mom or dad ever have headaches?
No.
Okay.
My dad's pretty healthy. He's 60 and never really been sick that I know of.
Oh, okay. So living in.
And mom is, she was diagnosed with diabetes earlier this year, or actually last year. She's 56, and as far as I know, that's her only medical problem.
Okay, so she's doing well. She's 56 other than diabetes. What about grandparents?
Her mother is also a diabetic.
Her mother's a diabetic, okay?
Yeah.
So you got diabetes on the maternal side.
Yeah.
Okay. All right, and anything else like grandparents, other grandparents? And your grandmother's still alive. That's diabetic, correct?
Yes, she is. She's 84, I think.
84, okay.
My grandfather on her side he passed away a few years ago at the age of 93. The only thing I know of that he had was atrial fib.
Okay, he passed away at 93.
Yeah.
Sorry to hear that.
Thank you.
You never ever really ready for him to go?
Never. And I'm not really familiar with my dad's family.
Okay, and so all right. Any siblings?
I do have a sister. She is 5 years younger than me, and as far as I know, she's healthy.
All right. Kids healthy? Both good and healthy?
Yes.
Okay. Good deal. So, mom's a diabetic, grandmother diabetic, granddad is deceased. Sorry for the headache deal. Other than that, nothing else you know of?
No.
Okay. So, I'm going to do a little, just ask you a few questions here. I don't want you to be uncomfortable. You ever have any trouble with depression, anything like that?
No.
Because some people do get depressed from time to time. That's normal, and you can. I want you to be able to tell us. I want us to have a good relationship. I want you to feel safe here. Say you're not having any trouble at home. Husband's treating you well. Any problem with anxiety? Like that, get nervous? No, not really. What about how do you sleep at night? How are you sleeping?
I sleep pretty good as long as the baby sleeps.
Good. So no insomnia.
No.
No insomnia. Okay. Can you tell me what day it is?
Today is September 22nd.
September 22nd. Okay, good deal. All right, now I've had these things on the table here. You've had a couple minutes to look at them. I'm gonna take them up. All right, and I want you to tell me what was on the table.
We had a lock.
Okay.
A marker.
Okay.
A watch and a set of keys.
Good job. Okay, and so now I'm going to I'm gonna repeat a few numbers, and I want you to just repeat them back to me. Okay, so first number is 1, 10, 14, 19, 21.
Right. 1, 10, 14, 19, 21.
Good. I have trouble doing that. I think you did good. Okay, so we're going to do a complete workup on you, natural head and toe. Are you not having any other problem? No trouble breathing, no shortness of breath, heart palpitation, no restlessness, nothing like that. Okay. So, no fever, your vital signs look good. Blood pressure 122 over 68, temps 97.7, respirations at 16, heart rates at 76 regular. So everything looks good here. We're gonna, if it's all right, we'll do some more tests on you. Maybe do some lab work. Maybe send you for a diagnostic procedure just according to it with fine, and try to figure out why you're having this headache. Maybe give you some prescription medication to see if it helps.
Okay.
Don't know exactly. We know you're having some form of headache. We just want to make sure that we get the right form, cluster, migraine, etc., and what works best for those, and make sure there's no underlying issues.
Okay.
Is there anything else that I should know maybe about your health? Anything you could have forgot? Okay.
No.
Or just looked. Okay. All right. Well, thank you so much. I'll be right back, and we will do some more work on you. It's good to meet you, Miss Atchison.
Thank you.
I hope we get to get you feeling better quickly.
Me too.